My name is Luis Torres. I came to Dr. Jacob because I was having problems with my left hip, and I went to see another doctor, and he recommended me to Dr. Jacob because this other doctor said Dr. Jacob is the one doing the latest research in hips and replacement and resurfacing, and he sent me to Dr. Jacob, and he was like my angel sent from above. My experience with Dr. Jacob and the whole team was amazing. From the moment I came into his office the first day, I knew that he was the person I needed. He was very confident. He gave me comfort that he was able to look at my problem and fix it. And the most important thing, I was like, Dr. Jacob, I just want to have no pain and be able to at least walk. I'm only 35. And he's like, we are going to take care of your pain and you're definitely going to walk. And from that day on, I was like, thank you, God. The JointExperience, there is no words to describe it. I love the staff. They took care of me like I was a newborn. From the moment I came out of the surgery to the day I left, they took such good care of me. They were so attentive to my comfort, if I was eating well, my pain level, my nutrition, my exercises. They check every 4 hours, every 6 hours. I didn't feel alone. I didn't feel left behind, or like, I just feel like I was the only patient in the whole floor, and they had tons of patients. There's like 20, 50 rooms, something like that, and I feel like I was the only one. And every nurse, every physical therapist, and to see the doctor come and check in, I was like, oh my God, doesn't he have any other patients? I felt very, very well taken care of. When I was in the rehab group, I was one of the youngest, and a lot of people would see me do the exercise, and it's like, oh my God, how can he do those toe rises so high? What do you do? And it was kind of a joke because I would come to the group exercises and we would start chatting, and the ladies would be like, so what do you do? Are you gonna teach me how to do that when I get better? So we got each other going, and it felt like family more than a stranger doing exercises. It kind of, we supported each other through the 30 minutes of exercises. Right now I feel fantastic. I can walk, I have no pain, and just to add the cherry to the top of the whole cake, I am dancing and performing with the Washington Ballet, taking classes and performing. So I'm really, really excited that not only I can walk, but I can also go back to what I love to do, which is performing.
And could you stop right there? And could you show us some of your flexibility? And could you squat down and give us a little leap and show us how you're doing? And first position and everything is fine. There you go. And when was, there you go. And when was your minimally invasive hip resurfacing done?
It was done in April 26th, and today is September 1st.
So it's 4 months.
Yes.
And how do you feel?
Fantastic. I didn't think I was going to feel better than the 6 weeks, but I'm feeling a lot better.
Now you're back to dancing, and are you back to instructing?
I'm back to instructing, and hopefully I'll be back to dancing in 2 weeks.
That would be fantastic. And is there anything you'd like to tell our people watching this?
If they're considering a hip resurfacing, this is the place. See?
And
I'm ready to go.
And you had that all done from the end to your approach, correct?
Yes.
And how long were you on a crutch or cane or anything?
I was in a crutch for 6 days and in a cane 5 days.
And then you were back on
Both
point.
legs.
Fantastic. We look forward to seeing you dance with the ballet.
Thank you.
You're welcome. For the folks watching this, we did your resurfacing several years ago, and both your hips have been resurfaced. Right. And you're a very high-level equestrian, is that correct? Mm-hmm. So you are competing at what level?
International level, FEI, Prix St. George.
And so you travel the world for this, correct?
Yes.
And before we did both of your hips, you obviously had bad hip arthritis, and it was limiting your riding. Mm-hmm. And due to the physical nature of it, we held you back a bit. So how long after your hips did you go back to international showing?
It was probably 6 months before I got back on a horse, and it probably takes a good year or two to get back to the kind of condition and coordination that it takes to ride at the international level. So even though I was riding every day after 6 months, it takes 2 years to get back at a really high level of riding. So that's just because of the level of riding that I do, and that's what it takes physically to get your body at that level, but not the hips at all.
Well, these are
Hips
quite
were
large
fine.
horses, are they not?
Yes, very large.
And how do you feel now with
Great.
your hips?
Not a thing I can't do.
So you're back to pretty much doing whatever you'd like.
Mm-hmm.
And your whole process of getting your hips resurfaced was not as bad as you expected, worse than you expected, or?
The first one went really well. Remember, I did the second one a week later. That was a bit of a surprise, but that was the only way I was ever going to get back to riding again soon. So it was tough, but doable.
And by a month, how were you walking?
A month. I was able to walk probably, I think on the month it was still with the walker. And then I went to crutches, then one crutch, and then a cane.
And your performance, so right now you're pretty much back to full activities, as we said.
Yes.
You don't frankly remember that you had your hips replaced per se?
Not terribly.
Great. We want to thank you for meeting with us.
Thank you.
And enjoy your continued success with your equestrian
Thank you.
events.
Thank you.
Thank you.
See you next year.
Yes, sir.
For anyone living with joint pain, I would highly recommend that they get in touch with Dr. Jacobs, discuss the possibility of a hip resurfacing, and go ahead and get it done. It's life-changing.
You want to stop right there and squat for us? Come on up. Come on towards us a bit. Thank you. Thanks for speaking with us, Howard. How far out are you from your minimally invasive hip resurfacing?
6 weeks and 1 day.
How do you feel?
I feel excellent.
When did you go back to the gym?
I went back to the gym at 4 weeks.
When did you get rid of your cane and everything?
I got rid of my cane 2 weeks after surgery, and really around the house it was 1 week after surgery.
You're obviously a pretty physically fit young man, so you're different from some of our patients, but how aggressively are you working out now and things like that?
My workouts are at about 80% with weight and about 80% cardiovascular.
And how would you describe your experience with the minimally invasive anterior hip resurfacing?
I would highly, highly recommend it. It was an excellent procedure and no pain, just a little swelling. It was fantastic.
How did the Joint X service on the Good Samaritan floor work out for you?
They were very professional. Food was great. I didn't even mind the 1 a.m. wake-ups. It was a very, very pleasant experience.
Well, thank you for speaking with us. Maybe we'll check with you in about a year.
Okay, great.
Thank you. Jeffrey, thanks for helping us. Could you take a walk towards us? And could you stop right there? Could you squat down a bit and come back up? Come on up and come a little closer to me. Very good. And your hip was resurfaced how long ago, sir?
6 weeks.
And how much do you weigh?
About 303.
And how was your recovery?
Awesome.
And when did you get rid of your crutches or walker?
Walker in 2 days, crutches in 3 days,
And
cane after 2 weeks.
so you've been walking without anything for the last couple of weeks.
Yes.
And how do you feel?
Great.
And you're back to doing most of your activities at 6 weeks?
Yep.
Lost a few pounds for me, sir?
Yep.
What would you like to tell our viewers watching this?
The hip replacement program is awesome. It's like magic.
And you actually had a hip resurfacing, is that correct?
Resurfacing, yes.
Because you're a younger man. How old are you, sir?
42.
Good morning, Larry. Could you take a stroll towards us?
Sure thing.
Okay, and you could back up a bit because you're so darn tall, you're filling up my screen here. Could you stop right there? Could you squat for us? Come on up. And how long ago was your hip resurfacing, Larry?
I think it was 6 weeks ago.
And you had one of the minimally invasive anterior hip resurfacings. When you got home back down south, by 2 weeks, what kind of activities were you doing?
When I tried to ride my bike, I couldn't, but I started driving. No problem driving, and I have a lot of stairs, so I did a lot of stair climbing.
And when did you get rid of your cane?
The first day I got back home.
And you've obviously you live alone and you're independent, and you're a professional baseball coach. Is that correct?
Yes.
And do you anticipate having any trouble going back to spring training and doing what you do?
None whatsoever.
Okay. And how would you describe your experience at the hospital with the Joint X?
I thought it was very good. I was treated very nice.
And it was a little bit stressful for you as you flew in and had your surgery the next day. And how long was it before you flew home?
Well, I flew the next, I think it was about 5 days after that. It was a really small plane, so that was the only bad thing, but I had no problem. They met me at the airport, and supposed to be in a wheelchair, but I walked to the car. So,
And that was at 6 days.
yes,
And how tall are you, Larry?
6'3",
And you weigh how much?
210.
Well, that's great. And we're happy you're doing so well, and we hope you get your World Series ring this year, Doc.
Oh, I hope so too.
You already have one. Perhaps you need another one.
That sure would be nice to have too.
He's walking around pretty good.
Yeah. So
He says he goes off when he goes to the metal detector at the airport, though.
well, actually, I wanted to resurface Chris, but he had a nice doc in Ohio or wherever he was, and he didn't want to take the inconvenience coming back. But I actually want to do what I did to Larry on him.
That's so
Good morning, young lady. Could you take a stroll towards us? And you could stop right there. And maybe you could back up a bit. Okay. Let me... could you back up a bit more? Good. Could you squat down for us and stand up? Could you pick up your right leg? Put it down. Could you pick up your left leg? Good. Would you mind coming towards us a bit? Okay, and without telling us your name, how long ago was your hip resurfacing?
6 weeks ago.
And how do you feel?
I feel fantastic.
And how long were you even using a cane?
After 2 weeks, I gave it up.
And you've been pretty much back to normal activities for how long?
I would say since the 3rd week.
Great. How would you describe your experience here?
It was wonderful. I wish I would have done it 2 years sooner.
And you had a hip resurfacing, is that
Yes,
correct?
yes.
And you had that done minimally invasively with the anterior hip approach, is that correct?
Yes, I did.
And it met your expectations?
More than met my expectations. I'm extremely pleased.
Is there anything you'd like to tell our folks who are looking at this?
Yes, if you ever need a hip replacement, go to Dr. Jacobs. He's the best.
Good morning. Thanks for chatting with us. Could you tell us, Miss C, how long ago you had your hip resurfaced?
It's been 2 years.
And what's your impression?
It is amazing. It's like I never had the surgery.
And you have a particular interest in yoga, is that correct?
Yes.
And has this met your expectations in that regard?
It's exceeded my expectations. I was in so much pain before I had the surgery.
And, I'm sorry, go ahead.
I was in so much pain before I had the surgery. I couldn't even imagine going back to feeling as good as I did years before this arthritis set in.
And can you show us how flexible you've gotten?
I can.
And would you say when you're at yoga you could pretty much work at whatever pleases you?
Almost, yes. I have damage to tissues that I tore many years ago, and so I have some scar tissue, and little by little I am stretching out more and more, and it's wonderful. I
And
feel
when
great.
when you were reading about it before you came here, what features of the resurfacing appealed to you?
The fact that I got to keep my bone, that I wouldn't have as much of a device in my body, and the potential for more flexibility.
Well, thank you very much. Is there anything else you'd like to tell the folks on our looking at this?
I highly, highly recommend the resurfacing surgery and Dr. Jacobs.
Well, thank you very much. You have a great day. Come on towards us, Miss R. Why don't you stop right there? And when did you have your hip resurfaced?
It was 6 weeks ago on Monday.
And how long have you been without your cane?
Oh my goodness, for about 4 weeks. And I've been covering the hospital, going everywhere, doing everything I want for the last 2.5 weeks.
So you went back to work at how long? At what time?
4 weeks after the surgery.
Can you take a deep knee bend for us?
Oh my goodness, of course.
And can you pick up one leg and then put down the other leg? And can you come a little closer to us?
Like,
Good. And would you say that the joint experience worked out well for you?
It was fabulous. Everything was better than I could have expected, and now I don't even feel like there's anything different. It just feels corrected. It feels perfect.
So it wasn't as anxiety-provoking as you expected?
No, not at all.
No. We don't want to reveal your age, but you're under, would you say you're in which decade, doctor?
I'm under 60.
That would be, thank you very much. Hey, Rick, would you come on towards us? You can stop right there. Could you bend down and snoop for us?
Like this?
Yeah, and come on up. And you're how far out from your minimally invasive hip resurfacing?
6 weeks and 2 days.
And when did you get rid of your cane and assistive device?
About a week after the surgery.
When did you go back to work?
January 19th.
How far was that after surgery?
I think 4 weeks.
That's the way, as it should be. We'll do the interview later, Rick.
Okay. Like a man, Rick. Encouraging me to hurt myself.
Okay, come on towards us, Mr. F. Okay. And you can stop right there, sir. And thanks for speaking with us. How long ago was your hip resurfacing, sir?
3 days ago.
And you have ankylosing spondylitis, is that correct?
That is correct, yes.
And how do you feel?
Actually great. I'm surprised that I'm this mobile this quickly.
And prior to surgery, your hip was not just painful, it was also very stiff, correct?
Oh yeah, yeah. It was almost impossible to get out of bed in the morning. It was quite painful.
And you had the hip resurfacing done through the anterior approach. Would you say the experience was more difficult, less difficult than you expected?
Actually, considerably less than I expected. I've gotten a lot of reassurances, but of course, you don't know until you're really there. And the fact is it's much better than my fears. In fact, it hasn't been that bad at all.
Excellent. And so you'll hopefully be off your cane in a week or so. Is there anything you'd like to tell the folks who are watching this?
Well, the same thing that folks have told me, 2 points. One is, I only wish I'd done it sooner, and it's the best thing that I could have done.
So you think that anterior approach to hip resurfacing has really profited your rehabilitation status?
Oh, absolutely. It's out of the way. It's no trouble at all. It's nobody likes getting cut, but it seems to be no trouble at all. It's not a problem.
Okay, come on towards me, sir.
Come towards you. And I do better if I think about what
Okay, and why don't you stop right there? Could you bend down for me?
Bend this way.
Sure, that'd be great. Come on up. Pick up your right leg. Down, pick up your left leg. Okay, I don't think I stand up straight. I don't even think our folks watching this can even tell which side we did, so why don't you tell us?
I did my right side, or Dr. Jacobs did my right hip resurfacing.
And that was done through the anterior approach.
Correct.
And how do you feel?
I feel very good. Better than I did before surgery.
How far out are you, sir?
I am 6 weeks post-surgery.
And you were walking without a cane or any assistive device, correct?
Correct.
And what did you tell me you did yesterday?
I walked for 1 mile walking my dog without the cane and with no problems whatsoever.
And how was your experience in the JointEx program at the Good Samaritan Hospital?
Extremely good experience. The staff, everybody was very well educated, knew what they were doing, had me moving along very quickly.
Was the experience better or worse about what you expected?
It was better than I expected.
Great.
I expected a lot of things to be a lot worse, and everything's going extremely well.
And even when you left the hospital, how were you walking at 3 and 4 days?
Oh, I was doing much better than I expected. I expected more pain, had very little pain, was able to walk very well with crutches. I expected to be using a walker, and so moved along, progressed very rapidly.
And that was a hip resurfacing done through the anterior approach. Well, we'd like to thank you for your for working with us. Do you have anything you'd like to tell the folks watching this?
Well, the if anybody has any whatever problems with their hips or even knees, from what I saw, as far as Dr. Jacobs is going to be the person to talk to try to get things back in order.
Well, thank you very much. Have a great day.